Hello, everyone. Our team is called VibeCoders, and our project is AI and healthcare focused. The bulk of our project is that we wanted to build a web app that would help people with keeping up with their vaccinations if they're traveling internationally. One of the biggest problems international travelers have is through contracting diseases when they go abroad, and this could hinder their trip, get take a while to um, heal because of lack of immunity and all of that stuff. And our app is using artificial intelligence to help them keep a check on their health and making sure they have their vaccination shots and medication ready before they travel internationally. So when a user logs in for the first time, an account is created. I'm using a demo account here, and the first time you log in, you're taken to a health information form. So you fill in information about your health, your past conditions, the diseases you are going through. If you've had any past surgeries, let's say bypass surgery for this, and current medications, painkillers, and let's say heart medication. For the purpose of simplicity, let's leave this part out for now. When we hit submit, you're taken to an interactive map. We use the map API that is interactive. The idea is when you click on it, it's going to populate a bunch of diseases that are prevalent in the country, and it's going to show you what you might need to be careful about and what you might need to take shots for. You can also download a checklist, which is for your purpose, which is basically to help you understand or make it easy for you to keep a track of the shots you might need to take. Obviously, go talk to your healthcare provider before you take any steps. That is our goal, but our goal is to help you out with that. So that is one cool feature we have. Another important feature we have implemented in our app is the use of AI and a RAG model in the backend that takes your information that you've submitted when you created your account. It basically uh, helps you. It's more also a personalized health helper. Am I healthy? And it gives you information about how you're doing, what you might need, and everything is dynamically populated because we're using a RAG model in the background. Let's say individual, individual, and it's going to try to take the information that we've submitted in the past and try to give us a little overview of how we are doing. This is all AI generated, or this is AI plus the database that we've used. And, basically, a lightweight RAG model. RAG model is in the background running everything for us. Let's say I want to travel to Russia with my health. What do I need to take care of? And it's going to try to see your health, take your health conditions, and basically give you a list of things you could do um, to keep yourself safe, to protect yourself when you're traveling abroad. So in this case, we see how medication supply, it's all done through the use of AI in the backend. So that is basically our project, to use AI and a few features, a few cool features to help international travelers um, make sure their health is okay. We have a bunch of cool features that we are going to add in the future as well. Um, the way we built this, we built the entire web app in React, and we used MongoDB as our database, and in the backend we used Express.js. Uh, we also used a lot of React libraries and React UI libraries for our UI. We used React Simple Maps for the map, and we used a bunch of other libraries for building it. Um, we primarily it's on JavaScript and JSX, and that is about it. And we are also using MongoDB on our backend, so we have credentials set up for MongoDB in the backend too. Um, and one of the biggest challenges we faced was integrating AI itself with a lightweight RAG model in the background. Another thing we've had a lot of issues with MongoDB Atlas itself. The amount of data we could store in that was limited, so we had to find some clever ways to do it by using vector embeddings and other stuff that we thought was useful. Another issue we had was with populating the uh, diseases through from MongoDB onto our front end itself. We also had issues having the back end and the front end talk to each other. Some of the things I'm really proud of is how the populated, how the diseases are populated dynamically. So based off of the information that's in the database, all of this is done dynamically. Also, the chat bot that we implemented is working real time with Mistral AI in the backend. Mistral AI was the API we used for our large language model. All of this is done in the backend as well, so we're super proud of that. This was a big learning curve for all of us, and we're super proud of what we did. That is all that we have to say. Thank you.